Our ASH coverage continues here from Orlando, Florida. Our pleasure now to have with us Dr. Tatyana Feldman from the John Theurer Cancer Center in Hackensack, New Jersey. We appreciate you stopping by. Nice to see you.
Well, thank you so much for inviting me.
Okay, so let's talk T-cell lymphoma. You've got a study, patterns of treatment for newly diagnosed and relapsed refractory peripheral T-cell lymphoma in the community setting. What's this about?
So basically, T-cell lymphomas are very rare diseases. And even though you say T-cell lymphoma, there are many different subtypes which behave different way. And it's very difficult to get appropriate knowledge about what's the best treatment and how to move forward. There were a couple of registry data which Hackensack did participate, including complete registry and Dr. Evans' retrospective analysis, kind of looking at the patterns of T-cell lymphoma treatment and outcomes. And I think the importance of the trial which we did at Hackensack is not necessarily how the trial was designed, but what was the methodology used. So retrospective analysis is very tedious. You have to pull the charts. It's very time consuming. There's some drawbacks such as missing information, lack of the data. And what was used in our study is basically, I think I would put it as advantage of technology. So we use clinical outcome tracking system, or basically it's a software which extracts the information from electronic medical records. So it kind of puts it, I wouldn't call it prospective study, but you have a real-time information as patients are entered into database and their outcomes are being monitored. And you don't have to go and try to convince 10 different sites to participate. So our CCA has multiple private practices which are part of our CCA, including Hackensack. And as patients are entered into the database, the program extracts the data and you can come up with results. And I think what was very significant about the results, they're very much in agreement in what was reported before. So you have somewhat different methodology how you collect the data, but the results are very much in lieu of prior analysis which were done by academic institutions.
So when you're talking with something like T-cell lymphoma, the advantage and the opportunities that technology gives you changes everything the way you used to do it.
And not just T-cell lymphoma. I think it's particularly important for rare diseases because it's particularly difficult to gather information about the rare diseases. You may have, I'm sure, some of the physicians in RCCA, they would have one patient a year. But if you get 100 physicians together, suddenly you have big numbers and you have a capacity to track the information you never had a chance to do.
What are some of the important highlights to share from your research?
So the PTCL, not otherwise specified, and NK cell lymphomas continue to be a very poor prognosis lymphomas. And as you notice in the study, there is no standard of care and multiple different regimens are being used because there is no perfect regimen. And a lot of questions remain unanswered about what to do next. So how do you sequence the salvage therapy? What is the prognosis of the patient who failed that drug? Will he respond to the next drug? And this type of information is very difficult to collect. I think this methodology will allow to collect the data which will allow us to get information about how the patient respond after they fail this line of therapy, that line of therapy, what would be how much time you have to salvage the patient afterwards, whether you have 6 months, whether you have 3 months, etc. I think it's a very useful methodology.
So there's still a lot of work to be done, but at least the ability to gather information is easier.
Right, and I think that's ability and a speed with which you can analyze the data. And you can apply it to not just T-cell lymphomas, but any entity as a matter of fact.
Thank you, Dr. Feldman. We appreciate your time.
Okay, thank you.
Okay.